Howdy YouTube family, it's Bolt CRNA coming to you again with another day's topic. So today I actually am going to be answering your burning questions that you guys have been asking me for years now that I could not really answer very openly on a lot of stuff before as a student, because you're a student and you have to be careful what you say and not misrepresent your program and all kinds of stuff like that. But now I'm my own entity and I'm a CRNA out on my own, so I can be a little more open and honest with you about my thoughts on things and all that. So we'll get into your questions today. Oh yeah, and special shout out to Metalita for their fancy lab coat that I got. This is actually a graduation gift. I don't think you guys have seen this yet, have you? This is new. How do you like it? Smooth, eh? I love this thing. Look, see the stitching? Can you see it? Not so well, can you? I'll show you a picture later. But anyway, this is the Wilson cut, and you know what? I'll wear it for this video because I like it. All right, so we'll begin with Vanessa RDZ3. She asked, any self-doubts before, during, and after CRNA school? Most nurses won't admit to it. Okay, so self-doubts, of course. If you don't have self-doubts when you're going into nursing in general, because it's such a huge, revered field that requires a lot of responsibility and a lot of knowledge and a mixture of humanities and sciences together, you know, even on the basic RN level, that requires a huge commitment, and it should be daunting to you, and you're probably pretty crazy if you're going into the field without any self-doubts or fears of fulfilling that role. And then especially when you become an ICU nurse, you're like an RN on steroids, and you're taking care of the most critical patients in the most, difficult situations and the most complex pathophysiology, and people die on you often, and you have to deal with that. You have to code them, or you have to try and prevent them passing, and sometimes you have to facilitate as pain-free as possible kind of passing and palliative care and things like that. So you deal with a lot of very intense things that a lot of adults in normal life just aren't capable of handling on a daily basis. And as a nurse, you're expected to deal with that day to day. And in a lot of people's cases, like in my case, you might be 23, 24 years old, suddenly as an ICU nurse, expected to deal with very complex emotions and in difficult situations. So yes, you should have self-doubt and fear sometimes, but you can't let that get to you. And then when you go into CRNA school, yes, you will most definitely have self-doubt. You probably will have some fears and self-doubts your whole career, and if you don't have a healthy amount of that, you're probably not a very safe provider. And then Vanessa also asks, where do I see myself 5 or 10 years down the line? That is a really hard question to ask because I'm just starting out, so everything's so fresh and new to me. Hopefully I'm here in California and practicing independently, continuing my independent practice and growing my skills and being an either vital member of a team or maybe having my own team. I don't know. We'll just have to see where that goes. And probably still being involved with the AANA and on a national level, and being a CRNA advocate, which I'll probably be the rest of my career. And if you mean personally and not professionally, Lord, I don't know. Hopefully married with kids, but who knows? E.M. Wells asks, what is the hardest part of CRNA school? This is a complicated question. There are so many hard parts of CRNA school, but I will have to say one element of CRNA school that caught me off guard, that I wasn't expecting it to be so hard, is that you kind of have to sacrifice your own personal idea of self while you're in CRNA school. You are not really allowed to say what you want to say and do what you want to do and post stuff on social media the way you want to post stuff on social media. You clinically cannot speak what you may be thinking. People will be able to talk to you in ways that you would never allow them to speak to you in a normal situation. But as an SRNA, you have to just allow them to kind of just have that conversation with you and speak to you in a manner, in a way, in a tone of voice that's completely inappropriate. And sometimes you just have to put up with it. And if it gets extremely outrageous, like they're cussing you out and stuff, you can lodge a formal complaint, but I'm just going to tell you most likely nothing's going to happen. The sad truth about medical training and SRNA training and things like that is you are a vulnerable population and there's nothing you can do about it. She also asked, what's the average debt SRNAs graduate with? In the past, I'm sure it was different, but now that it's a doctorate requirement, most people have around $200,000 in debt. And that's, a lot of people just think about tuition when they think about going to CRNA school. They don't realize that you're not going to be able to work for 3 years while you're in school. So unless you just have independently wealthy parents or somebody who's just willing to pay for your cost of living as an adult for you, you're going to have loans that are going to pay your cost of living for 3 years on top of paying for the tuition and fees. So it usually comes out to about $200,000, although some students have a little more than that. And some others, might have a little less. But you can count, just kind of average and say, I'm going to plan for $200,000 in debt when I'm done. Someone asked, can someone with NICU experience, only NICU experience, get into CRNA school? There are some programs that will take NICU experience. My program actually will, although I have heard of one RN who told me they were not accepted to my program years back when they applied because they only had NICU experience. But we had a girl graduate with us who only had NICU experience. She never worked on adults. She did NICU and I think maybe some PICU, but she never did adult ICU and she got accepted. So it is a little harder to get in when some programs absolutely won't take you with NICU. So it's not something I would recommend you going into right out of nursing school and doing NICU. But if it's all you have and you really want to go to CRNA school, just apply, see what happens. Eric T-Pan asks, what books that were required for CRNA and which ones worked the best for you? You're going to have so many textbooks. I think each of my courses, say I took 5 courses every semester, I think each course probably had four required, what's considered required textbooks, and probably 4 other non-required but suggested textbook, and that was probably every single class, and you're talking 5 classes a semester. So I mean, there's an outrageous amount of books. How many that I actually purchased? Not very many at all, I'll tell you that. Fraser Boy wants to know, what should nurses study to get ready for CRNA school? Okay, I get this a lot. People want to start studying for anesthesia before you start the program. It's hard to do that because anesthesia is so complicated, and as an RN, some of the baseline information you don't really have yet to even be able to start comprehending some of the concepts. So, I mean, as an RN, you have like half the picture. You need the full picture before you can start studying anesthesia. And usually programs will start you with that the first semester or 2 of the program. They'll start introducing that other aspects of pathophysiology and the other aspects of medical knowledge and stuff that you didn't learn in nursing school. They start incorporating that in pretty intense crash course stuff, including like biochemistry and some concepts like that you don't really focus on in nursing school in your undergrad. Those are very difficult courses, difficult sciences, but that was what a lot of my first year of CRNA program was like. And then they start building on the physics and all kinds of stuff like that. So then they start introducing more anesthesia concepts later. So what do I recommend ICU nurses do to be prepared for CRNA school? Study ICUfacts.com. There's a lot of really great stuff on there. Get your CCRN, study the material for the CCRN. You really just want to be an exceptional ICU nurse who knows the pharmacology and the pathophysiology of what's going on with the patients, and just develop that critical thinking that you need to be able to do in critical situations for your patients. That's what makes you an exceptional anesthesia provider, is that background experience you have that makes you unique to other people who are anesthesia providers. BakeJaker123 asks, what should a new SRNA bring for the first day of clinicals? Now, all of you type A's out there, I already know you're going to do this. You're going to have bought a 5 million, you have 6 different calculators and 40 different types of pens, and you're going to have bought crazy amounts of stuff. You're going to bring 7 textbooks with you to clinical. It's always funny when you always know when it's somebody's first week as an anesthesia student, because they're just loaded down with a crazy amount of stuff. Clipboards, and I'm guilty of this. I did bring a clipboard with me and a handful of other stuff, and it turns out you're going to leave that clipboard sitting down somewhere and you will not come back to it. You'll lose it. I mean, textbooks are going to get put away in the break room and you will not have time or the ability to pick them up at all. It's funny. You're not going to use any of that stuff. You need to bring a notepad. I brought like one of those little tiny memo pads that fits in the back of your scrub pocket, so you can write down details. If a patient tells you, oh yeah, I quit taking this med last week, and it's some weird thing that you've never heard of before, write that med down. And then go look it up or consult with the CRNA or consult with the physician anesthesiologist and say, hey, the patient told me this, in pre-op, and I need to talk to you about the changing of the anesthetic plan to, coincide with this new change. I did, in fact, my first year of clinical, I pretty much wrote down my patient's information on that notepad like every day. Any patient I had information, not private, not HIPAA violation information, but like, these are their meds, these are the pathophysiology going on, this is like, I want to do ketamine, I'm going to do how much of ketamine based off this much weight and all that kind of stuff. I wrote all that stuff down because at a moment's notice, you're going to get pimped and quizzed all throughout the day. And if you don't have the answer, at least if you pull out your notepad and say, I wrote down my answer and I prepared and I researched out what I wanted to do and this is what it is. And now you can't have a big old notebook or whatever like that because you can't carry that around. So get a small one that fits in the back of your pocket or something and carry that around. I carried around like 4 different pens because if one of them goes bad, you have another one. So that's good to go. I carried around a felt tip Sharpie pen that I could write on medication labels, because that's a big part that you don't really think about when you start anesthesia rotations. Is you're going to, especially at your first or second year doing clinical rotations, every time you drop a med, you better be filling out all the details of like time, date, whatever, medications, concentrations, everything on that label. You're going to be filling it all out and put your name on it and stuff. So that you know exactly what med you have drawn up, what concentration it's in, and the CRNA you're working with also knows what you've drawn up and what meds in there. You got to be very careful with your medication, so keep one of those pens in your pocket too. Of course, a stethoscope. You always have a stethoscope on you, and you'll get scrubs and a cap and a mask when you get there. So I think that's it. I think that's the only things I kept with me all the time throughout my anesthesia training. Oh, I forgot. Get the Vargo app and the Block Buddy app on your cell phone. All those 25 textbooks that you're going to want to carry around with you, you will find out that if you have the Vargo app, the Vargo anesthesia app, it's like $100. And if you have the Block Buddy app, which is like $20, that's going to give you almost all of the information you're going to need for anesthesia that you're going to be giving. And it's also going to give you the Block Buddy app will give you really good regional kind of pictures and walk you through different processes in case you need to brush up on some of your regional stuff before you put in an adductor canal block or something like that. Another good app, it's a good website actually, I think it's called Medline. I use that a lot to look up different types of medications, especially if they're not anesthesia related medications and they're just more like general medicines that I've never heard of for like some type of chemotherapy agent or something like that. I usually look it up in Medline. And Up to Date is a good website to have on your phone. Medscape's what I said Medline earlier. I mean Medscape. That's the pharmacology app that I used a lot of times. PubMed is really good. I have PubMed on my phone. And Open Anesthesia. I have Open Anesthesia on my phone, which came in hand one time when I had a what was it? It wasn't myasthenia gravis. It was some other. It was a bizarre neuromuscular disease, a pretty complicated case of it. And I was trying to look up different types of medication interactions and which ones I wanted to use versus didn't want to use. And that app helped me, the Open Anesthesia one. So I'm Almost Nurse Erica wants to know, can classmates be trusted? Oh gosh. So something that you'll find when you get into this kind of level of education, whether it be law school or med school or CRNA school, people are very competitive. All of you were very competitive to get into the program. All of you are going to be, they tell you to not compete with each other, but there is a sense of competing that goes on between classmates. I was kind of like an open book. I didn't care if someone knew I did well or not so well on an exam, but the majority of people in class are going to be very secretive about that kind of stuff. Some people do kind of judge each other based off whether somebody's doing very well clinically or not as well or whatever. Can they be trusted? I'd say yes, mostly. Your classmates are in general like your family, maybe a dysfunctional family, maybe a family that you dislike half the time, but or half the people half the time, I'd say, that you dislike. But overall, you're all in this together. You're all going through this really tough war together, and you're going to have multiple battles along the way that you're all going to try and survive together. So as far as like trusting them with like super intimate details and just all that kind of stuff, no, I wouldn't go that far. I mean, there will be some of your classmates that you will become close to, and sure, and trust them. But I would in general have a baseline level of trust with everyone in the class. My JJNF wants to know, am I going to date now that I'm out of school? And the answer is yes. Side note, Bumble, I don't know if y'all use this app called Bumble, but I've got on it here recently, and I've been trying to use it because I'm new to California and I don't really know anybody here, and I'm trying to find some women in the area that kind of match my interests and would be compatible with me. It's a struggle. It's a struggle. Either we're just not very compatible on paper, or we are kind of compatible on paper, but then like you're texting back and forth through this app and one of you just stops responding after a day or so, and it's silly, but yeah, I'm giving it a shot. We'll see how it goes. SoCal Fritos wants to know, what were the cases that challenged me the most in CRNA school? I would have to say my most challenging rotation and the most challenging cases I dealt with was my cardiac anesthesia rotation. I did a rotation at a pretty complicated cardiac place. They did they probably did about like 4 or 5, maybe 6 cabbages a day, maybe more than that. They would usually have like 3 cabbages running at once. They had a hybrid room where we did TAVRs. A lot of times we do TAVRs under awake, MAC, anesthesia. And what else did we do? We would do heart transplants, LVADs, all that kind of stuff. So yeah, it was very, very complicated anesthesia. I had already had my semester long of cardiac anesthesia course. So like a lot of the textbook information I already knew, how much your ACT needs to be over 400 or more before you go on pump and things like that. I knew a lot of that stuff. So it wasn't so much just the specific academic information that was hard, although that can be hard too. It's just the very fact of like you're sharing the patient with the surgeon in a way that's a little more involved than a lot of other cases. Neuro is similar in a way where like you and the surgeon have to be very closely intertwined with what's going on, what they're doing, what you're doing. Each of you affects the other person a lot in your practice. And the patients are usually super critical with cardiac. Usually they're ASA 4s and 5s. They're very sick people. They have a lot of cardiac disorders and a bunch of other comorbidities. And you have to put an art line in pretty much all of your patients. And these are patients who have like little tiny spider arteries in their wrists and stuff. They're with calcium deposits all up in it. And once you've put in like 75 art lines in a row, and they're all super sick, hard art lines, and they prefer you to not use the ultrasound to start. If you're struggling and you can't get it, then of course you pull the ultrasound in and you do it with the ultrasound, but they prefer you to try and use skill without it. And placing central lines and floating swan Ganz catheters and PA catheters down, it just is a lot of skills. Like you're just doing a lot of stuff over and over again. And I got a chance to do a lot of PA catheters, and I got a lot of really great complex experience. The CRNAs pretty much ran the anesthesia there. There was a physician anesthesiologist who would come in and help out if you needed some help, or he would check once we put the TE probe down, he would come in the room intermittently and check to see how the valves were looking and stuff during the surgery. But really the CRNAs ran everything there, and the CRNAs were very smart, smart, but they were very hard on the students. They expected an extreme level of excellence from us, and they expected that by the time you got done with that rotation, you would be able to like somewhat run a cardiac cabbage case on your own, with them kind of sitting in the back of the room just like there as backup for you. And I was able to do that by the end of the rotation, but it was stressful. It was a lot of very early mornings. I'm talking like 4 a.m. kind of mornings, prepping. Just preparing for those cases would take you an hour and a half sometimes, like just physically preparing all the equipment and stuff. They did not have anesthesia techs there. We, the SRNAs, were the anesthesia techs. We set up all the cardiac stuff. And there was no residents there besides us, so we always got the best cases, and we always got the sickest of cases and stuff. So that was nice, but it also it made it a very hard rotation. So I would have to say that was probably the hardest part. Lexi Jordan Brown wants to know what was going through my head during my first semester of CRNA school. First, it was extreme excitement. Just like a lot of you who are applying to CRNA school and maybe just got your acceptance letters, you're riding the high of that wave of just like, man, I've got in this thing that I've planned to do my whole, maybe the last 10 years that I've been planning to do with my life and career. I've got accepted, I got in. That's the first huge obstacle that you have to get over, is like just getting into an actual program. Some people never get in. They apply multiple times, multiple schools, and never get in. So you are a very lucky select few if you get accepted. So you're riding that wave and you're excited, and you're just ready to learn anesthesia. You're so eager. You're so ready to learn all these sciences and all this hard stuff, and then they hit you with it. Then you start going to class day after day after day, and you're realizing you're doing like 3 and 4 hour stretches of just like they're throwing this information at you, and it's going way over your head, and you're just overwhelmed beyond what you thought you could be overwhelmed by. Like the amount of information, because you go into CRNA school being super cocky. I was too. No, I'm not trying to offend anybody, but as an ICU nurse, you took anatomy and physiology in undergrad, you did all these other science courses, you rocked out through your BSN, you did well through that probably, you went straight into the ICU, you took sick post-cabbage patients, and you've dealt with really, you've saved lives, and you've dealt with really complex things, and you've titrated meds, and you've been an integral part of the, team taking care of really sick patients. So you kind of go in thinking like, I got this, like I'm good. And then you start your first few weeks of CRNA school, and you realize like, oh shoot, that what they want out of me right now is nothing related to what I'm knowledgeable about and what what my background is in, because this is not about clinical experience or whatever. This is about like memorizing every single thing that this certain anterior pituitary gland secretes, that then secrete which feedback loop does this. And yeah, you get that in undergrad some too, but now they take it on like a microcellular level in CRNA school. They take it to a extreme broken down level to where it's very complicated, and they start and there's the speed at what they throw it at you is much faster than what they did in undergrad. They start throwing massive amounts of material at you, just lumping what you would have maybe learned in 3 weeks in undergrad. They're going to throw at you in 3 days in CRNA school, and you're going to have a test the upcoming Monday on all that material. So anyway, that is what I was thinking first semester of CRNA school. Super excited, still riding this wave of excitement and glad to be here and glad to learn, and then realizing, oh my God, this is the hardest thing I've ever done, and I don't know if I can survive this. Austin Falick wants to know, what is the difference between DNP and DNAP? DNP is a doctorate of nursing practice, DNAP is a doctorate of nursing anesthesia practice. The only real difference between these two, they're both doctorates as a CRNA. You're both pretty much going to learn the exact same things. It's kind of like the difference between an MD and a DO. There's really not much difference. You're going to learn the same things. Your degree is slightly different, but really the same. DNAPs, it means that they went to a CRNA program that is not connected to a nursing school. So a school of nursing has certain regulations and regulating bodies that govern it, and they also have to do certain things to meet guidelines. to be a nursing program, and they usually have a BSN program. They'll a lot of times, they have nurse practitioner programs, and they have nurse educator programs and nursing leadership doctorates and executive leadership and nursing doctorates and stuff. So that's like a nursing school. So a CRNA program connected to one of those nursing schools is called a DNP. If you do not have a nursing school, and say it's just like the Mayo Clinic, I believe. Like the Mayo Clinic, I don't think actually has a nursing program, but they do have a CRNA program. So they're considered a DNAP. And I think in the past, some of your doctoral project requirements were slightly different depending on if you did one versus the other. But from all of my friends who did DNAP and things like that, from what I've talked to them, logistically, it really comes out to the exact same thing. Like, it's not a big deal. Go to one versus the other. I don't think it's going to matter for you in the long run. Richard B2019 wants to know, what's going on between the ASA and the AANA? What do you think about AAs? That's a complicated question that's about a century long in issues. The ASA and the AANA are market competitors, just like CRNAs and physician anesthesiologists are essentially market competitors. We, in person and logistically, in practice, we get along, we practice together. Sometimes we don't practice together. You don't have to practice with each other if you don't want to. And there are some places where the physician anesthesiologist, they have just an exclusive physician anesthesiologist group. They do not work with CRNAs, and they just do their own thing. They do stuff without us. And then there are other groups that are CRNA only, and then they just run their own groups of CRNA only, and they don't collaborate or work with physician anesthesiologists. And then there are the most common model of employment in the U.S. is both people working together as colleagues and collaborating. So yeah, it's tricky. This is a really long topic to try and talk about, but I would just say they don't get along. We would like for them to get along, and I would love for the ASA and the AANA to come to an agreement and to be friends, but for financial and political reasons, it probably is not going to happen. Brady RN wants to know, did your perception of what a CRNA is and does change before and after you were in anesthesia school? I would say yes. In a vague sense, yes. And that's probably true of anyone. I would say anyone who goes to dental school and gets done with dental school and becomes a dentist, they probably realize, 4 years ago when I started this journey, I probably I probably have a slightly different perspective on the field now because I'm educated and experienced in it now. Epitome of Kristen says, what are the biggest issues SRNAs and CRNAs face today and your thoughts on how to overcome them? Plus, like previous comments, now that you've graduated, looking back, would have done things differently. Current issues facing CRNAs today. They're the same issues that have been facing CRNAs for 100 years. Competing in the marketplace, making sure the world knows who you are and what you do, and marketing yourself properly to patients and to congressmen and people who make laws and decisions that govern your practice. Getting reimbursement appropriately from insurance companies and stuff, Medicare, Medicaid, CMS. Dealing with changes in healthcare, the future of maybe AI being involved with us. Miss Shawnee Baby 19 says, UU is my top choice for school. She means Union University. How was your overall experience at Union University? Any tips for the interview process? My experience at Union was great. The only thing that makes Union a little bit unique, different from your typical program, is it is out of a Christian university. So there are like foundational rules that are baked into the university's rules, like no alcohol. That makes it different. So the only time that really affected you in your day-to-day was when you would go to anesthesia conferences or you would go to anesthesia events and stuff where it's social mingling or whatever. If you were there representing Union, as a student, which you're pretty much representing Union everywhere you go, you are not allowed to drink alcohol. And you will actually legitimately get in trouble if they find out you're at anesthesia events and stuff drinking alcohol. So other people around you may be having a cocktail and mingling and stuff, and they may ask you, like, why are you not drinking anything? Why are you drinking water the whole night? And the fact is, you just cannot drink. And that's one regulation that will be different to you. Another thing is, I mean, I'm a Christian, so I enjoyed this, but if you're not a Christian, you may not like it, that before every exam you take, the professor says a quick prayer over the class and just, prays that you'll remember things well and that you'll do well in this exam and that you'll, he's pretty much, he or she supports you in the exam going forward. So anyway, I liked it. If you're not a Christian, you may be annoyed by that. And my tip for preparing for a university interview, I would just say, it's just like with any other anesthesia program you're going to interview at, really have a good idea of why you want to be a CRNA, be ready to tell them that, and don't be trying to search around in your head of why you want to be a CRNA, because it better be on the tip of your tongue and you better be sure you're ready for it. Because if you don't have a really strong reason why, you're going to drop out of the program, because it's going to get really rough. And once it gets really rough, if you don't have an extremely strong reason why you're not going to give up, you will give up. So they want to see that you already have a strong reason why you want to be a CRNA, and it's a legitimate good reason. Other thing about union is be able to talk about your spirituality. Like what about you is spiritual? How does it affect your daily life? And how will it affect you going forward in your future? They want to see that you're three-dimensional at least. They don't want to see you as a one-note person with a GPA and certifications and experience on a piece of paper, dull and boring. They want to see you for who you are. JE Counterpart says, did you negotiate your salary? Is it similar to the ways physicians do it? Example saying the company says we'll give you $200,000 and then you say you want $300,000. Yes, the way you negotiate salary as a provider is the same whether you're a physician or a CRNA or whatever. You're going to have an idea of what you're worth and what you expect to be paid, and they may offer you a certain amount, and you may say that's not enough. So yes, everything's open to negotiation. Never just take things at face value and just sign the contract when they offer it to you. You always negotiate more CME or more vacation time or a better schedule or more base pay or whatever's important to you. Some of the benefits package stuff you can't really negotiate as much. Like you can't say, oh, you do 5% matching on your 401k, I want 10%. It's like kind of a group decision thing on a lot of those things. So they can't personalize those types of benefits just for you specifically. I think it's a across the board group thing. But yeah, as far as like salary goes and some basic stuff like that, you can negotiate that, and you should be negotiating that. Mandy May 2018 says, what are your thoughts on the name change debate from anesthetist to anesthesiologist? So I think I mentioned that just earlier on another question, but so that's a big thing. The AANA officially decided that the word nurse anesthesiologist is an appropriate title and a descriptor, and it's updated its formal documentation and stuff so that it has it included in that documentation and supports it as a descriptor. And some of the states have been formally recognizing this, like New Hampshire and Florida, I think, are the newest states that have said, like, hey, we formally on paper support this term. Even though you don't really have to formally support it on paper, it's a title descriptor, so it's already appropriate to use it as long as you say nurse anesthesiologist. You can't say you can't say I'm an anesthesiologist, because that's a nondescript term. Physicians are their official title from their organization, the ASA, is physician anesthesiologist, and our official title from our descriptor, whatever you want to say, from the AANA is nurse anesthesiologist. It's clearly identifying which path you took for your education. I think it's smart. I think it's a good idea. I think patients already have, for many, many decades, already called CRNAs anesthesiologist, and they don't even know what the word anesthetist means, and they also don't know how to say the word anesthetist. I have family members who cannot pronounce the word anesthetist, and so they awkwardly try and stumble around the title and figure out what I'm trying to say. And they also forget the sequence of the word CRNA, and they'll say CNRA, and they'll say all kinds of stuff. And that's my own personal family. So I can't imagine what just some lay person who doesn't even know anyone in anesthesia is thinking or trying to, say those words. So nurse anesthesiologist, everybody knows the word anesthesiologist. People understand that to mean the person who puts me to sleep. You must say the word nurse in front of it because you're not trying to misrepresent who you are and your background and education, but it's a clear understanding when you say nurse anesthesiologist that I'm a nurse who is also your anesthesiologist putting you to sleep today. And patients really respond well to it, and other people in the medical profession seem to understand it well and respond well to it. So that'll probably be the way things go forward in the future, and it'll probably be officially the name change and probably be the official certification change and everything in the future. So look forward to that. Miss Pinay says, in a hospital setting as a CRNA, would you be working nights with the same bedside nurse hours, 12-hour shifts 3 times per week, or would you be during the day with some added benefits, no holidays, etc.? This person's asking me, like, what's the schedule like as a CRNA? The schedule's varied. Your schedule can be Monday through Friday, 7 a.m. to 3 p.m. if you want it to be, with no call. There's some practices that are set up like that where you can do that. Or you could also swing all the way the other direction and work 60 hours a week and work a total flexible schedule and do all-night OR call and 24-hour OB call on the weekends and do all kinds of stuff. So yeah, pretty much in anesthesia, the schedule is going to be whatever you want it to be, depending on the practice you choose to work for. And it's a very flexible field. That's one of the best things about anesthesia is you can really make it whatever you need it to be for your lifestyle at that time. Of course, your money and stuff may fluctuate and change based off how many hours you're working and how much commitment you give to the company. But yeah, I mean, if you don't mind your money and financial situation changing a little bit based off how little you work or take no call and work no weekends and do no holidays and all that stuff, you're totally fine to do that. T. Primal asks, is there any states to avoid working in or going to school in? This is kind of like an inflammatory question. I hate to say anything about this because it might insult some of the people in those states. But there are certain states that are kind of known to be not as CRNA friendly. And not saying that you can't have a good practice there, because it certainly doesn't mean that every single practice and every single environment you're going to work at in that state is going to be bad. It just means that you hear more often than not political things and rhetoric that's more negative in those places. And I'd say places like Pennsylvania, New Jersey, New York State, and Florida State are pretty classic places that you hear a lot of stuff about that are not positive. So I'm not saying that if you get into one of those programs, you should just not go to school there and not go to CRNA school. I'm just saying, look into it. Well, all right, guys, that is everything. I have answered all of your questions. It took me 2 videos to do it all in, but I hope that I answered your questions fully. If you have any more questions, hit me up on Instagram. It's Bolt CRNA over there. Follow me on Twitter. It's also Bolt CRNA over there. I have a Facebook page now too. I went ahead and put a Facebook page up there because people kept asking me, hey, where are you at on Facebook? Hey, can I add you on Facebook? And I really only use my personal Facebook account for like my personal friends and family that I know, not really open to the internet. So yeah, I created that Facebook page. It's Dr. Jason Bolt over there. You can find me, and I post things sometimes over there, my videos and stuff. So if you want to follow me over there, you can do that too. And make sure and hit this video and subscribe. I think I already told you that. I'm rambling now. Bolt out.